via Zoom.
Sorry, just remembering the recording. Okay, we're going now.
Oh yeah, now we're going. Okay. It's so good to be here with all of you. I wish I could be there in person, but with all kinds of scheduling and other issues, it made it sort of difficult to do it, but I'm glad to join all of you. So today I'm going to be talking about engaging with race and culture in psychotherapy. This is such a vast topic, as you can imagine. How do you do this topic justice when there are many nuances and components to this issue. So I'm going to try to focus it more specifically on my work with racial minority immigrants. And I'm going to start with a more personal story, and I'm hoping that beginning with something personal will let you know something more about myself and sort of what I bring to my work with patients. So with that, let me begin with the personal. A little bit about my background. I arrived with my family to the United States from India when I was 7 years old. This was in 1977, and we lived in the Bronx in New York City. That was the first place we moved to. And at that time, I would say that I brought with me the burden of colonialism, caste, Hindu-Muslim conflict, gender-based violence, sexism, heterosexism. You can imagine sort of the various things that one brings from the immigrant experience to the new country. I was born in Hyderabad, India, which is a large multicultural city with a long history of tensions between Hindus and Muslims, and also among people of diverging Hindu castes and subcastes. As a Hindu in India, I had belonged to a majority religious group, although I belonged to a Hindu subcaste, which was frequently victimized by verbal harassment and violence in this particular region of Hyderabad. And when I say violence, our home at one point was actually torched, and so burned. And so our family, it became this incident where our home was torched, was an impetus for our family to actually migrate. And there was this dispersion of family members across India for a period of time, and then many of us moving to the United States. So that's sort of the backdrop to what I mean about sort of the intercaste violence at that time. So for me, the experience of being an insider and an outsider were very familiar, even before moving to the United States. And the internalization of these events in my early childhood was met with a new set of problems, particularly xenophobia and racism in the US. In India, I had not identified as an Indian person or a person of color, and that all happened after migrating to the US. In India, I was a Hindu of a particular subcaste, and in the US, I adopted different labels like Asian American, South Asian, etc. In the US, race takes a particular form, but when you're not categorized as Black or white or maybe indigenous, you are often seen as on the outside of racial politics. Yet I know that I'm not outside of those American racial politics. Indians in the US, and more broadly, South Asians in the US, have, like every other cultural group that is raised upon migration, we have a framework for understanding race. And more often than not, these frameworks are less visible and more likely to be dismissed by notions of immigrants as people who are choosing to come to the United States. And indeed, immigration entails a choice for many. We know, however, that immigration is certainly not a choice for children, and becoming racialized is also not a choice. Many adults who come to the US are, most people are actually unaware of the deep entrenchment of racial politics and racism in the US. I think that awareness is actually improving given the internet. But I do think there's a lack of understanding or awareness around how racism in the US might impact immigrants' lives, their children's lives, their grandchildren's life, and so on. In my early adolescence, just to move forward a little bit from that early time, in my early adolescence in the 1980s, I lived in a suburb of northern New Jersey. And this was an era that later became known for the dot busters. And I don't know how many of you are familiar with who the dot busters were at this time, but the dot busters were a group of people. They were a white street gang, basically, that victimized through verbal harassment, physical violence. They victimized South Asians who were, at that time, there was an influx of South Asians into that area of New Jersey, regions of New Jersey, as well as northern Pennsylvania. And so this particular group was prominent in my life and that of my brothers, and that my brother and I walked home from our predominantly white school feeling anxious about whether or not we'd be followed and harassed by these group of white kids from a neighboring town who would seek us out on the walking path from school. And so our home was vandalized with racial slurs etched in the snow of our front yard, saying things like "Hindu, go home." So these painful events made it very clear that being seen as different meant that one is an outsider, even though we were seemingly acculturating to mainstream culture and learning how to participate from the inside at school and at work. We spoke English fluently by that point. We wore Western American dress and ate American food. However, these changes did not secure insider status, but instead created feelings of otherness and hopelessness about belonging in this new country. And as we know, the problems of xenophobia and racism continue from one generation to the next. And I have two sons who are now young adults, and certainly watching their development and the kinds of stereotypes that they've had to continue to endure, like South Asian men as terrorists, as all kinds of different stereotypes. So we see these kinds of things being transmitted from one generation to the next. I'm sharing this personal experience with you as a way of recognizing very explicitly that we each bring our own experiences of racism and xenophobia with us to the clinical encounter. All our socialization is present, whether it's conscious or unconscious. And so in this presentation, I'm going to explore the dynamics of race and racism in recent years with a particular focus, as I mentioned, on racial minority immigrants and how these dynamics impact psychotherapy from a psychoanalytic perspective. You'll see how my personal experience that I shared with you will come back later on in my presentation as I share with you a case vignette of a South Asian patient that I have worked with. So just to move from the personal into more of the professional and the academic, we're all aware that more explicit forms of racism and xenophobia have heightened since Trump's presidential campaign, and also in the midst of the pandemic, as racial minorities have been targeted with harassment and violence and victimized by COVID at disproportionate rates, and also blamed for causing or spreading the virus. And since 2016, there has been I think a normalization of stereotyping and racism in public discourse, just as much as there's been a resistance to it, there's also been this kind of normalization. So if you remember kind of the language used by Trump and many of the supporters around immigrants and racial minorities being criminals and rapists, et cetera, that in some ways, even though on a conscious level, we may be rejecting or standing against those stereotypes and labels, there's been an unconscious way in which, as a country, we've been internalizing, these kinds of attitudes as though it's just normal part of how life is now, and that some people in the United States feel this way, and this is how it is. In fact, there was a term called the Trump effect that was used by some psychologists to describe the notable increase in racialized, xenophobic, misogynistic, homophobic, transphobic bullying in school since Trump's election. So the day after Trump got elected, I know from my own neighborhood, but in certainly all over the country, where children in elementary schools were being told by their peers or teachers that they're not legal or that their parents are not legal. You'll be rounded up and sent home, things like this that were immediately, it was pretty astonishing that it happened very, very quickly after the election. I do want to mention also, since an area of mine that I focus on is Asian American psychology, that I want to also underscore alongside the violence against Black men and women and Black trans folk, the COVID-19 outbreak has been rife with racist sentiment and attacks against Chinese Americans and those perceived to be of Chinese or East Asian descent. So if we think back to the Atlanta spa shootings in 2021, the Pew Research Center had conducted a survey just shortly after that, about a month later in 2021, focused on anti-Asian discrimination. And the survey found that about a third of Asian adults said that they feared someone might threaten or physically attack them. And the vast majority of Asian adults, about 81%, also said that violence against them is increasing, far surpassing the share of all US adults who say the same. Another study that was published in 2020 by Che and colleagues with Chinese American parents and children between March of 2020 and May of 2020 indicated that nearly half of parents and children were targets of online COVID-related discrimination. So I mention this because it's often a silent type of discrimination that has not received a great deal of attention from the media, but nonetheless is a terrifying new manifestation of anti-Asian discrimination and violence. If we think about Asian Americans, we constitute a highly heterogeneous population. We also differ with regard to physical markers of racial categorization. And yet our experiences are most often homogenized. In particular, if we are East Asian or Southeast Asian or South Asian, our ethnicities and our sociocultural differences tend to get erased. We're simply Asian or South Asian to those outside of our communities. We also hold a unique position in the broader racial hierarchy of the US. We're often minoritized objects when it's convenient to non-Asians. We're viewed as privileged or model minorities, also when it's convenient for others. But either way, I point this out because our subjectivities are often diminished or ignored. And even within our professions, I see this in psychology as well. We're seen often as racial minorities when it suits others. So let me just share a quick example of this invisibility. Last summer, I had been working with a high school senior who is an Asian American boy, young man, on a research project. He had reached out to me because he was worried about the anti-Asian sentiment in his high school and in his town. And he wanted to raise more awareness about mental health concerns among Asian American adolescents. So when I asked him, when I was getting to know him, I asked him about his experience of being a Chinese American in his school. He said he didn't really fit into the stereotype of Asian boys. And he said, well, I'm a football player. I love academics. And he actually developed a program in his school to support Asian kids dealing with mental health distress. He then started to tell me that his white and Black teammates don't really understand him. One of his white teammates, in fact, told him, I like Asians because you guys don't complain about racism. So my student was taken aback and once again felt invisible. To me, one of the most striking things about this incident is that his teammate is fully aware of the fact that Asians experience racism, but made it clear to this student, my mentee, that he didn't want to hear about it, that stop complaining. And I like you because you don't complain. So you can imagine, the kinds of incidents like this that a young person internalizes and the cumulative impact of this on one's sense of self, one's sense of belonging, and how that could contribute to mental health stress as well. So I want to move now to talking about some psychoanalytic perspectives on xenophobia and racism. So on to some theory. to help us think about this further. Xenophobia manifests in intrapsychic and interpersonal realms. And so psychoanalytic perspectives, in my view, can elucidate an understanding of prejudice and aggression. Psychoanalysts have written about the role of early life experiences like separation anxiety as fundamental to developing benign prejudice as a way of differentiating specific objects of attachment, like parents, from other objects. And with regard to developing malignant or harmful prejudice, a psychoanalyst, Henry Parents, underscored the role of ambivalence towards objects of attachment, implicating the use of defenses such as projection or denial, the role of childhood trauma and neglect, and the demands for children to identify with their parents. Relatedly, a Turkish psychoanalyst, Vamek Volkan, emphasized the role of parents transmitting traumatized self and object images related to traumatic dislocation into a child's self-representation. And he described a process called depositing. And he pointed out that depositing is distinct from identification, in that depositing involves an adult mostly unconsciously using a child to become a reservoir for certain self and other images belonging to that adult. It's important to consider that the intergenerational transmission of trauma and traumatic stress and prejudice can encompass a wide range of defenses like denial or projection. For example, a parent who's experienced by a child as loving and attentive, and at the same time holds negative attitudes towards immigrants, may consciously or unconsciously communicate these attitudes and expect that the child carries similar negative attitudes as a condition for maintaining a sense of connection to that parent. So it's different than identification in that in this idea of depositing, it's as if the child is demanded upon unconsciously to believe what the parent believes as a way of maintaining this affective connection to the parent. So what Vamek Volkan is describing is this kind of unconscious process that takes place. So the child in this case becomes a container for hateful attitudes towards immigrants or others, which then become dissociated from loving images of that parent. Ilani Kogan further noted that xenophobia has roots in early childhood, when an infant's fear of strangers can mark the quality of relationships with a caregiver, and specifically whether the infant develops a response of curiosity or that of fear. So what Kogan refers to is a basic interpersonal survival mechanism in infant development. And she suggested that strangers represent an attack on our inner equilibrium, and that rather than tolerating this destabilization, we hold the stranger responsible. So an inner conflict becomes externalized and aggressed upon someone who has less social, political, or economic power. The strangers then are seen as the lazy, dirty, stupid, exotic, violent, non-human objects. So it's important to consider that xenophobia and racism internalized in childhood and adolescence are not only located in family dynamics and parent-child interactions, but they're also located in schools, neighborhoods, workplaces, ethnic and religious communities, political groups, and social media communities. It's typically, we tend to think about, when we do our intakes and we take a developmental history of a patient, we focus heavily on family dynamics and sort of where a person has grown up and what the interpersonal relationships might have been like, but far less do we pay attention to their dynamics in schools, workplaces, social media, and other communities that children and adolescents have regular interaction in. Continuing on with theory for a moment, Salman Akhtar noted that the defenses underlying prejudice become rigid as individuals show little or no interest in others who are different from them with regard to religion, culture, race, and other aspects of social location. And they tend to socialize within their own sociocultural groups. And Akhtar further described what he calls unmentalized xenophobia as an important consequence of this defensive structure. In particular, unmentalized xenophobia impinges on our ability to develop a sense of cooperation with others, to explore and form friendships and intimate relationships that pose new perspectives, countering or challenging rigid notions of other people. Going back to Ilani Kogan, I love her work in partly because she poses some really interesting questions that are what I would say stand outside of traditional paradigms, and particularly liberal paradigms as well, which I think is important to question. And she actually posed an important question regarding the inner life of majority status individuals and groups. And she stated the following. She said, liberal thought and international human rights laws recognize the rights of minority groups to maintain their cultural identity, but assume that majorities have neither a need for similar rights nor a moral ground for defending them. Kogan's point can be extended to the invisibility of whiteness in the US, and more specifically within the clinical encounter. For example, when I've asked my white clients about their ethnicity, many of them report not having an ethnicity, but initially at least, and they will say, well, I'm just white. And so to me, this is really an interesting kind of response. And so for me, I think about this as in terms of transference, and the transference dynamics in these interactions at times reflects my patients' anger or envy about not having an ethnic identity that's visible to others. There's a disavowal of migration history in whiteness. And other times it reflects their guilt and shame about having the ability to choose whether or not to think about ethnicity or race. So these dynamics can also indicate a wish to maintain white privilege, as there's an implicit message in stating, I'm just white, that conveys the feeling that their Indian American therapist is the one that's different or unusual, and that their whiteness is the standard reference against which my Indianness is perceived. But in all of these cases, the patient's wish to be seen is diminished by a disavowal of family migration history and messages of white as standard, privileged, and oppressive, all at the same time. So I want to move to saying a few things about the internal experience of racial minority immigrants. Xenophobia and racism have profound effects on how immigrants experience themselves in relation to others and on their sense of belonging. Immigrants and their children negotiate conflict, identity, and belonging and health within the parameters of constraint delineated by xenophobia and racism. Salman Akhtar, in a beautiful essay that came out in 2014, the essay is called The Mental Pain of Minorities. And in this essay, he pointed out that minorities are not just people who exist in smaller numbers than the majority, but rather become colonized subjects who in general have less voice, representation, and fewer resources. He suggests that being a minority reflects cumulative trauma, where the protective and holding functions of the society at large accrue over time and put a silent but palpable strain on the ego, both at the individual and collective level. And an important paradox is put forth in his perspective, that is that the majority group tends to ignore the presence of the minority group, and yet at the same time unconsciously desires the minority group, which becomes a target for externalization of the majority group's paranoid and depressive anxieties. So Akhtar poses the question, if one is not wanted but does exist, then what is one to do with one's existence? So let me repeat that. He asks the question, if one is not wanted but does exist, then what is one to do with one's existence? It's often the case that racial minority immigrants experience anxiety, confusion, and despair related to not knowing how to be fully seen and present, and at the same time invisible to the majority group. Further, one has to potentially sacrifice authenticity to be seen and accepted by the majority group, and also to secure safety. So it's not just simply an issue of you know, trying to be authentic or true to oneself. And I think most human beings are struggling to do that in some way or another. But there's a degree of safety, there's a level of safety and security involved in addition to this issue of authenticity. I want to share a few thoughts that I have around the complexity of negotiating identity in the context of immigration. The process of migration, even in circumstances where an individual is not fleeing trauma, it's inherently stressful and often encompasses traumatic intrapsychic shifts. There are many cultural and environmental shifts that mark both anxiety and the pain of mourning, and adaptation to new and divergent cultural contexts can necessitate a compartmentalization of subjectivity and dissociated self-states. The lack of sense of continuity in the immigrant experience typically remains unconscious, as efforts to meet the demands of survival in the new cultural context dominates everyday life. It's often the case, I know in psychology literature, especially in the 1990s, and I would say even through the 2000s, there was this common notion that you arrive to the new country and there's a series of stages you go through in terms of acculturation. And the more you're able to integrate both your heritage culture and the mainstream American culture, the healthier you become. And I challenge this idea because the idea that there's only one pathway to healthy development for immigrants is hugely problematic, as you can imagine. And it also serves a dominant wish and a dominant narrative for this kind of melting pot idea that, if we all just kind of assimilate, then we'll all be happy and get along. And that's really not how this process works. So in my view, a psychoanalytic perspective kind of offers a more nuanced perspective with regard to what happens internally regarding acculturation. For many immigrants, securing economic stability and family structure, attaining access to education and other opportunities, successfully navigating language, these are all key aspects of survival. Immigrants are also seeking to secure a better future for their children in relation to opportunities available. Therefore, the psychological losses inherent to cultural change are perceived as necessary sacrifices for fulfilling these goals. Additionally, the conflicts associated with cultural shifts lie largely in the unconscious experience, as immigrants forge on towards adaptation while at the same time retaining their heritage culture and minimizing the pain of loss and separation. I do want to underscore that second and later generations often have a unique experience as compared with earlier generations of immigrants. So when I'm saying first generation and second generation, I'm referring to the first generation as those individuals who arrived to the United States as adults. And the second generation are those who are born and raised in the US. There's also 1.5 generation who are people like me, arrive as children or early in adolescence and are primarily raised in the US. So the second generation typically seeks to both retain aspects of their heritage culture and immerse in mainstream society, moving beyond the goal of survival, which I just described of the first generation. Growing up in the US poses fundamental differences in second generation folks as they develop a sense of identity within a context of race, gender, and sexuality that contrasts from that of their parents. In fact, we have now many empirical studies related to racism, focused on racism, that indicate that stress that's related to racism, while experienced by racial minority immigrants of all generations, has a greater negative impact on second generation racial minority immigrants. These findings actually parallel another phenomenon in psychology research known as the immigrant paradox. And the immigrant paradox is a phenomenon that's been noted in my research, as well as the research of Maggie Alegria's and David Takeuchi's research, and many others at this point. And the phenomenon of immigrant paradox refers to this finding, or the majority findings in research that compares mental health outcomes between the first generation and second generation, specifically among racial minority immigrants, Asian American, Latinx American, Afro-Caribbean, and African immigrant communities. And so what these set of findings indicate are that the second generation racial minority immigrant origin individuals have actually been found to have worse mental health and educational outcomes compared with the first generation. The reason we call this the immigrant paradox is because this is counterintuitive, and of course counters the goals of immigrants themselves to have a better life and more opportunities for the second generation. But what we find in terms of mental health outcomes is that the longer you stay in the United States, the worse mental health outcomes actually tend to be, both in terms of depression, well, in terms of various indicators: depression, anxiety, eating disorders, substance abuse, and suicidality. And this has been found across racial minority communities. It is not, at the same time, it is not found in white immigrant communities. So if we look in white immigrant communities across generation, we don't find this same pattern. This does not mean that the first generation does not experience stress, but because of course, first generation individuals do experience tremendous stress as well. But when we look at the overall outcomes, this is a pretty consistent finding that we see in research. So it raises to question, what may be going on? And many of us have come to the conclusion, or at least speculate at this point, that growing up in the United States poses specific challenges to racial minority immigrant kids, where there's a cumulative impact of racism and xenophobia that impacts development and pathology, psychopathology, mental health, and well-being overall. There also tends to be, if we look at the first generation, we're also looking at individuals who have been raised with and have fairly consolidated identities by the time that they arrive to the United States, which is very different than developing an identity in the context of a racial hierarchy within the United States. So these are the kinds of different developmental lines that we see with first and second generation immigrants. So the studies around the immigrant paradox also call to attention the issue of acculturation gaps. And I don't know if you're familiar with that concept, but the term acculturation gap has been used to describe cultural worldview differences between immigrant children and their parents. So where we might have generation gaps, of course, all societies, all families have generation gaps. That's kind of a universal phenomenon for the most part. But acculturation gaps refer to actual cultural worldview differences between older and younger family members. This type of intergenerational acculturation gap has been noted in the immigration literature for quite some time now, for the last at least 20 years. It's important, however, to note that these acculturation gaps reflect mirroring that occurs outside of the home context, where children are exposed to new ideologies concerning race, genders, and sexuality that contrast with their parents' pre-migration context. And acculturative stress that's experienced in contexts outside of the parent-child dyad is typically not discussed in immigrant homes. So if we think about how to understand these acculturation gaps, we can think about how each member of a family has their own separate experience of acculturation and their own separate experience of negotiating acculturative stress, including racism. So it could be that parents and caregivers are dealing with their own types of stress. Children are perhaps being bullied or facing stereotypes at school. And what's happening is that this information is typically not shared among other family members. The children tend to be quiet. They don't tend to share these experiences with their parents because they're worried about burdening their parents further, or they might be worried that their parents simply just wouldn't understand. what it's like to be in school in the United States or grow up in the US. So the reason I bring up this issue of acculturative gaps is because typically in psychotherapy, what I have noticed over the years is that if I'm working with a patient or a family, oftentimes there's this narrative which takes place where the child is seen as the one that's more American and Americanized, Westernized, and the parents are more traditional. And the parents really need to understand that the child is American, and so the parents are outdated and they need to get up to speed. The problem with this approach that I have found is that there are a few things. One is that the parent sort of loses authority as a parent when a therapist determines that one is healthier. The acculturative strategy that the child is using is healthier versus the parent. So there's this disconnect that doesn't actually help bridge a parent and a child. But the other reality is that the other thing that's being missed in that kind of narrative is that we're not acknowledging or recognizing that, in fact, each member of the family is experiencing different types of acculturative stress that is not being talked about within the family unit. And so, rather than sort of disconnecting family members, we ought to be thinking about, as therapists, what can we actually be doing to bridge, if that makes sense. Of course, there are times in a traumatic circumstance where that's not possible or appropriate, but we do need to rethink about in terms of how our own theories around health and pathology might actually influence what happens for our patients, both individual and families. I'm just going to check and see how I'm doing here on time. So I will keep going for a few more minutes. The other thing, that I will say about this kind of disconnection, the internal disconnection that within the family that I'm describing, it can also certainly lead to a disconnection within oneself, and where a child or an adolescent and then later an adult starts to develop a dual sense of self. This is a term that's been used by Alan Rowland. And he describes the dual sense of self, where a person develops separate compartmentalized self states such that only partial experiences are shared among family and friends. And therefore, the subjective experiences of the first and second generations are not just invisible to broader US context, but also within families and within ethnic and religious communities. So going back to that example that I shared with you earlier about the dot busters, in fact, most South Asian immigrants who arrived after the 1990s are not aware of who the dot busters are. Those of us who came before, we know because there was word of mouth, that spread around, but there was no media coverage, practically no media coverage of what had happened during that era, which, by the way, lasted over a decade. And yet the more recent immigrants from South Asia would not know about that history necessarily. So there are all kinds of disconnections that I want to point out, that people sort of live in these compartmentalized states often, which can, of course, be problematic. So moving to exploring race and xenophobia within psychotherapy, many of us are struggling with how to address multiple forms of social injustice, sociocultural trauma, the political polarization in the US, compounded by the pandemic, of course. And back in 2018, there was an interesting study that was conducted by Solomonov and Barber, Jacques Barber, in a study. They conducted an interesting study. It was published in 2018, and it examined the effects of the US presidential election of 2016 and the current sociopolitical climate on patients' experiences of psychotherapy. And their findings are really interesting because they indicated that most therapists and patients shared either implicitly or explicitly their political views with each other in psychotherapy. they also found that there was a stronger therapeutic alliance that was associated with perceived political similarity with the therapist, an implicit political disclosure of the therapist, and helpful political discussions in therapy. And the findings are consistent with clinical evidence that sociopolitical issues are an inextricable part of the therapeutic process, whether you're naming them as such or not. And yet, at the same time, I think as therapists, we contend with questions concerning how to engage with sociopolitical context and the timing of these discussions with our patients. And as xenophobia is largely experienced in conscious life, but also in unconscious life and embedded in early object relations, addressing these questions remains particularly challenging. For me, the current political context has made it even more explicit, the importance of initiating discussions about race and culture in psychotherapy, and being able to actually reflect on our own experiences of race and culture as we bring it inward to our work. So I want to just wrap up by sharing with you a brief case vignette of a patient that I've worked with. His name is Arjun. I call him Arjun. And I'm hoping that listening to this case will sort of bring some of this material together, and we'll open it up for discussion afterward. Arjun is a 43-year-old Sikh Indian American, heterosexual, cisgender man from a middle-class background. He had emigrated from an urban area of North India to the US when he was about 3 years old. Arjun was coping with depressed moods since his separation from his wife, and his sadness and grief had escalated since his divorce finalized. He has joint custody of their 9-year-old daughter. And when I saw him, when I first met him, he had been worried that while he feels a strong connection to his daughter, that she will lose a sense of family stability because of the divorce. Arjun and his parents left their extended family home in India and moved to the US in the 1980s after being sponsored by his uncle. They moved to a rural area of the Midwest where his parents worked in a hotel business managed by Arjun's uncle. Outside of this extended family, which included the aunt and uncle, they had little access at that time to an Indian or a Sikh community. And a few years later, Arjun's younger sister was born, and they remained fairly close. And over the next 5 years more, Indian immigrants had relocated to this region, and the family tended to center their social life primarily around this Indian community. At school, Arjun felt isolated for many years, particularly during middle school and high school, when he felt different from the predominantly white students and teachers. He was frequently bullied in high school, and in 2 incidents was beaten up by 2 different white boys. In both incidents, although he suffered physical injuries, the school did not provide any protection or support. There were no repercussions for the boys who had assaulted him. Arjun also faced racial slurs such as sand N-word and towel head throughout his adolescence. He rarely told his parents about these experiences. And in fact, he didn't tell his parents about being assaulted until his mother noticed that he had been covering his face with his hair. He had long hair at that time. And when she learned about the assault, she was deeply worried. She was alarmed, but he pled with her not to tell anyone at school. He was afraid of being further ostracized. He had a close relationship with his parents and sisters, but felt as though they couldn't really understand what he was going through and didn't want to burden them. In addition to coping with these incidents at school, he also endured significant stress related to his parents' experiences of racism. In particular, his father, who had worn a pugri, which is the turban, during his initial years of living in the US. The father had also faced verbal harassment from people in their town pretty regularly. His father decided to stop wearing his pugri and cut his hair when Arjun was 8 years old. In one of our sessions, Arjun described this moment as both a relief and as one of the saddest times of his life. His father told him that he too should not wear a puggree when he's older, as this would, quote, invite trouble. And about 2 years after this incident, Arjun's home was vandalized by people who wrote all kinds of stuff in their walls, like "go back to your country." And even though the father reported the incident to the police, there was very little that was done. I worked with Arjun in weekly psychotherapy for about 3 years, and then we paused, and then recently he's actually come back. But when I first met him, he had hoped to meet with an Indian American therapist, as he felt increasingly disconnected from his Indian American identity and his extended family. He hoped that by working with me, he could explore his identity further, his cultural identity further. I had asked him, when I asked him about his adolescence, just growing up, he told me that he coped with all of these different experiences of racial trauma by withdrawing from others. He read a ton. He loved reading. He loved his academic work. He excelled at school, eventually attended a college in the Northeast. And he described his college experience as very positive, as he was able to connect with other South Asians on campus. He also fell in love with a young woman who was also Sikh American, and they dated for over 3 years. Very tragically, she passed away due to a terminal illness, leaving, of course, her family and Arjun devastated. Arjun told me many times that he didn't quite know how to cope with this loss and has never really dealt with this. Not that, there was any endpoint to the grief, of course. He visited his family occasionally, but over time felt disconnected from them because he felt that people didn't quite know how to help him grieve, and they couldn't quite understand the depth of his loss. And they would sort of say things like, "You have to keep moving on." And that was their way of coping with it. In his late 20s, he met a coworker whom he later dated and eventually married. And his former wife is a white cis woman with Scottish and German ancestry. And Arjun described her as someone who brought some vibrance in his life. And although he cared deeply for his wife, he felt as though there was something missing in their marriage. He admired the way she took care of their daughter, but felt that she wasn't particularly interested in his Indian or Sikh identities. In one session, he said, it was almost like she didn't want to talk about our differences, like, let's just be colorblind. And I think the differences were too much for her to talk about or deal with. For me, though, we have a daughter who's mixed, biracial. She never wants to deal with that. So over the years, they became increasingly disconnected from each other, which eventually would lead to their separation. And even he told me that even when he had disclosed the bullying and harassment that he had gone through while growing up, his wife would say, his former wife would say, that those things are in the past and now things are better for Indians, which led to him feeling more distant from her. Following the separation and divorce, he felt isolated and was reluctant to reach out to family and friends for support. And his fear of isolation, of not being understood, manifested in our relationship at varying points. For example, a few months into our work together, he said, "I don't know how much to say about what I went through with my girlfriend in college or with my wife. It's hard to know who will really understand." And then he would say later, a few months later, he would say, "You probably have Indian friends and you're probably really connected to being Indian. I don't know how Indian I feel anymore. I feel so alone sometimes." And in these moments, Arjun expressed his experience of not being understood and his fear that no one, including me, would be interested in actually knowing him more fully. So I would respond by saying things like, I'm wondering if you think I too am not interested in knowing how you really feel about being Indian. And he would say, "I sometimes worry that you might not see me as Indian enough." And I would assure him that there are many different ways to be Indian and that I'm interested in learning about his experience more specifically. And he responded by letting me know that he never felt fully Indian nor fully American. He missed his family and his Indian American friends, but the loss of his girlfriend in college left him fearful of losing more people in his life. And over the course of our work, we explored his ambivalence about his Indian identity by talking more in depth about the loss of his girlfriend, his hopes to find connection in his marriage, and the racial trauma that he endured while growing up. And I want to underscore that this was not just sort of in the past. He actually continued to face more subtle forms of racism in graduate school and workplace, where some people would share their negative stereotypes about Indians as smelly or nerdy. They would make insensitive comments about people wearing turbans. These types of comments increased in frequency and intensity after Trump's election, actually, which heightened Arjun's grief and sense of hopelessness. And he tended to keep silent in these interactions, but felt deeply sad. And when he described these incidents to me, he would ask, I know these are small things that shouldn't bother me, but they stay on my mind. And in these moments, I felt angry, actually, that Arjun experienced these microaggressions and saw them as small things. And it, of course, brought back for me my own experiences growing up and what I continue to experience even today in more subtle forms. And when I brought up to him that these may not be small things, actually, they could have significant effects on your mood or how you feel about yourself or about other people. And he would say, he would typically respond that he never felt as though these problems were significant enough to talk about with others. In one instance, he said, there are Black people getting killed by the police. There's so many bad things happening to other minorities. Indians, we're just supposed to put up with it. We're not Black or white. We're just supposed to be model minorities. If you go through something, just keep moving. These, in fact, were messages that both he and I received within our respective Indian communities, but also in the broader US context. And these messages reinforce the myth of that model minority idea, as if we don't have the right to complain or voice pain in the face of racism. They also reflect the silence within Indian American communities concerning discussions about racism and racial violence and about other painful losses and traumas. So let me stop there. I've been talking a very long time, and I would love to just open up discussion, questions, etc.
Let me just say thank you very much, Dr. Tummala-Narra. We have plenty of time for discussion. If you'd like to put on your video and then we'll and ask some questions, you can raise your hand, your electronic hand or your real hand, and I'll hope to see you. You can also put some questions in the chat if you like, and we'll read them and get them all organized. I see Andy raising a hand there. I'm just getting our technology organized. There you are.
Here I am. Hi. Thank you. This is really wonderful, thoughtful, clear, and just appreciative of you raising and addressing all these issues. I wondered if I could ask you to say a little more about self-disclosure in the therapeutic relationship in terms of thinking about when and how to introduce one's own identities and how that might look different in different treatments, including when there's some perception of shared identity or reality of shared identity or not, or lacking those things.
Mm-hmm. Yeah, thank you so much for that question, Andy. It's interesting because of course it depends on the positionality of the therapist, so in my case, there's already a lot of self-disclosure without me saying a word because there are all kinds of, I'm a visible minority. And so, even from the time that a prospective patient sees my name, they start wondering, all kinds of fantasies about, okay, is this an Indian name? And what's the hyphen thing about? And, all kinds of fantasies. But I do think, regardless of whether we're a visible minority person or not, or if we have any type of minority background or not. There are all kinds of fantasies that our patients might have about us. So there's, I think we have to expect that and see that as an inevitable kind of part of a therapeutic dynamic. I think, so sometimes when I've worked with, patients, I sort of get different kinds of questions about my background. Some will be very forthcoming and ask very directly, what's your background or your religion, etc. Other people might be more subtle about it and say something about their own background. And if I feel like, okay, if I get the sense that they want me to say something more about myself, I do actually say very explicitly in the beginning, if you have questions about who I am, please ask me. If you have any questions for me, it might relate to my sociocultural background, anything about me, please let me know. And I'll do my best to respond to you in a way that I think will be helpful to you. So I always try to keep the benefit, how does my response actually benefit the patient? Is it something that will be useful for the patient? And is it benign enough for me to respond rather than sort of, keeping it to myself? Does it feel withholding to the patient if I don't respond directly and honestly to them? So I might respond very openly about my background. There are other, questions around sexuality, for example. I've had patients ask me about, my sexuality, for example, or wonder about it, and ask me in an indirect way. And I will try to make it more explicit between both of us and say, I'm wondering if you're thinking about what my sexuality is, and, and put it out there for the person, because I want to normalize that kind of discussion. And what does it mean that I identify as a straight woman, and for you? So I try to bring it right into the discussion. But I also don't, if I feel uncomfortable sharing something about myself, I will actually share that too with my patient and say, I'm not sure how that might be helpful to you or not, but I will share something about it, that I feel comfortable sharing with you at this point. So I try to be very direct and honest about issues of self-disclosure, but I understand that it depends on our own degree of comfort and also our own positionality and what's visible and not visible. So it's a very long-winded answer, but I hope it helps in thinking about this more.
All right, I see a couple of questions in the chat. Let me just start with the first one I see. Excuse me. Did you ever share or process with him your anger at him minimizing his negative experiences, and how did you deal with it? I presume that means the last case you talked about.
Yeah, yep. So I wasn't feeling angry with him. I was feeling angry that I was feeling angry that both of us, and I think most Indians are kind of taught that within our communities to kind of think, just keep going, don't give it too much thought. And I think it's adaptive in certain ways, because if we thought about it all the time, it might, render us feeling more helpless, right? And yet at the same time, it wasn't given enough space or time typically. And so I was upset at, I think, the systemic factors that sort of led him to feel that these were just small things, the insults and the comments. And so, so I didn't share with him that I was angry with him because I wasn't angry with him, but I did share with him that, it's really enraging to me sometimes that, this is how you're made to feel, or people who are Indian and South Asian are often made to feel that, some people's pain is not, as real or is not as important. So I did share with him that. And I think it allowed him to sort of access what he was feeling, his frustration, that it was okay to acknowledge the racism against Black people in the United States, while at the same time acknowledging that there was racism that he faced and that South Asians faced. So it wasn't as though he had to also choose, he didn't have to sort of operate in this Black-white racial dynamic, that he could sort of think beyond that paradigm for himself.
All right, let me go to Marlene next.
There may not be enough time for this, but I'm recalling in a previous presentation, you had a patient who made negative comments, an Indian patient who made negative comments about your caste.
Yes.
And the question was, did the patient know this about you or not? But how you handled that, I'm remembering that and thinking about patients who present and express negative sentiments against an identity that I hold. And, how much do you bring that into the room? How much do you say, do you not say? So if there's time, I would love to hear what hear you share with people here a little of how that worked for you.
Sure. Yes, I've had patients who've made negative comments about my identity, and so in this particular case that Marlene's referring to, this was an Indian American woman who came from a caste that is higher than my caste. I'm a lower caste person. And you would think that the caste dynamics reside only in India or South Asia, but in fact, they permeate, and the pre-migration context of discrimination is often transported into the new country and intrapsychically. So, the client, who was deeply ashamed of her beliefs around caste, at some point in our work together also expressed, her wish to identify with the higher caste, because that gave her a sense of specialness as an immigrant in the new country, that I'm different than these other immigrants, I'm better in some way, as a way of coping with her own self-loathing, as a way of her own experiences of colorism in her family, of being devalued for having a darker skin tone. So these were issues that I felt were important to directly address with her and share with her and disclose to her what my caste was. And in fact, I had ended up that my lower caste status mirrored the lower caste status of her mother. So her parents are mixed caste status, the father having higher status and the mother lower status. And I think the self-disclosure in that case helped her to reckon more deeply with this difference between her parents, who both of whom she had a very complex set of feelings about. So that's, I think that captures it in a nutshell, but yes, I've written about that as well.
All right, let me read. There's another question in the chat. It's very informative. With regard to the intergenerational issues and the acculturation process, I wonder if the implications as you've defined them apply similarly for individuals and families moving to a less westernized culture.
Okay, yeah. It's interesting. I think that if, it depends, it's interesting, because just because you're in a less westernized culture doesn't mean that you're not dealing with some form of discrimination. Every country has its own sort of subgroups and majority minority populations, whether we're talking about demarcations based on skin color, phenotype, or we're talking about social class, disability status. So I think it depends greatly on what the broader social hierarchies might be, the socioeconomic hierarchies might be in that particular culture or society, and how that impacts the family. So it could be that I'm moving to a country where there's more similarity between my own heritage culture and the mainstream culture of that country, in which case I may not experience the same degree of discrimination or discrimination at all, in a sense, but I think largely it depends on the social structure that a family is situated within. And that has implications for that acculturation process.
I don't see any further questions in the chat. I don't see anyone waving vigorously at me, but please, there is some time if anyone would like to ask more questions, discuss more things. And if not, oh wait, I see, no, I don't know what I see. Emily, have a hand up. Where are you?
Yeah, hi. Can you hear me? I cannot open my video.
Wait, sorry, Emily, the sound is pretty bad. Your microphone is doing something a little bit, lots of feedback.
Oh, can you hear me now?
Yeah, sounds better.
Okay, thank you, because several of us are using the same office. So
Right,
maybe
everyone
that's
mute yourselves in there except for Emily. Yeah.
Thank you. Yeah, thanks for the sharing. It's a very interesting topic. And I think it's very interesting to hear your perspectives about people think about the model minority. People think, oh, model minority and that may not have the right to complain or voice our pain. But at the same time, thinking about like complaining things, sometimes it's also a very US thing, and sometimes expectation for people to like to advocate for themselves or to be more assertive or to complain or to even to give the voice out. Is that also kind of some expectation of assimilation? Because sometimes I think like in Asian culture or some countries in Asia, people make changes, but make changes through different ways, not through complaining. So I'm curious about what's your perspective on that?
Yeah, that's a great question. It's interesting, the whole idea of model minority. Now we have a lot of research actually that focuses on the impact of the model minority stereotype and the internalization of the model minority stereotype within Asian American communities. And what we find is that there's an adaptation, there's an adaptive quality to the model minority stereotype, and that if you believe that, you know, I'm in a community where we are successful academically, financially, we don't rock the boat and we don't make waves. And, you know, this is something that one values in terms of how they adapt to a new society. I think there's an adaptive quality to it in that people do find themselves, you know, sort of engaging in behavior where they are perhaps working really hard. They are they keep moving as a means of survival, and so that's the adaptive part of it. The maladaptive part, what we also find is that there are aspects of the model minority stereotype when internalized, that it actually has harmful effects on mental health, that in fact people feel burdened by that, incredible pressure to excel in every way, pressure to be perfect, pressure to not make mistakes, and also to be silent when there is real pain that one is experiencing, whether that's a mental health concern. If you couple that with a cultural stigma around seeking help for mental health, then it becomes even more problematic. So what we find is that there's an adaptive quality to it, but there's also a maladaptive aspect to the model minority stereotype. And for those people who are experiencing stress because of issues like racism, and if there isn't a space, if that mental health stress is not being addressed, and there isn't a space for it to be addressed, then it becomes even worse. And so we do know, for example, that racism-related stress has direct consequences for mental health among Asian Americans. And this is true for Asian Americans from all different ethnic backgrounds. So, you know, it's a complicated kind of issue, but, you know, I imagine highly individual as well. And also many differences between first generation, those individuals who arrive as adults or later in their life, versus the kids who grow up in this country, who've had cumulative effects of racism throughout their life. And so you see bigger impacts on mental health for the second generation in particular.
Thank you very much. Yeah, that's helpful.
Thank you.
All right, I think time is up. There's one more question in the chat. Shall I read it? I'm going to read it. Should we try to squeeze it in a minute?
Sure.
Should we start to assess immigrant cultural values and belief around mental illness and implement some into their plan of care?
Yeah, it's a very simple response, but yes, it's a really important thing to think about, because I mean, if we can ask our patients about how they understand their experience, how are they understanding what they're going through, and what's the approach that they have tried in coping with their distress, and what are the people in their families or their communities, what do they do to cope with stress, to learn more about that, just their explanation for the mental health issue, but also their explanation for how they approach mental health issues. I think that is really important to bear in mind in developing a plan of care.
All right, I think now we should wrap it up. So thank you very much, Dr. Tummala-Narra. Sorry about the Zoom applause, but that was a wonderful presentation. Thank you for sharing your personal stories and your professional expertise, and give us lots to think about. So thank you very much.
Thank you. Thanks, everybody. Great to see you all.